Pope Leo XIV recently recognized the efforts of a group of hospitals dedicated to serving children from underprivileged parts of the world. EWTN Vatican contributor Zofia Schubeck has more.
How much is a child's life worth? Not every country or region can ensure to provide good quality healthcare to the children that need it the most. This is where patrons step in. They believe that there should be no boundaries for children in need of medical care. Patrons of World Children's Hospitals are a US-based non-profit organization established to fund and support pediatric healthcare for marginalized and vulnerable children.
It was very simple for me. I received a call from the Vatican. It's one of those calls you can always say yes. Since then, I've been involved leading the patrons for almost 4 years. And every day of my life, I think and do something and try to help these children that otherwise would not have access to any other sustainable source of healthcare.
Sierra Leone is probably the country in the world, and certainly in Africa, that has the highest children mortality and also women mortality. And so that's a combination of different factors. There's malnutrition, there's infectious diseases, but among all of them, there's few doctors in Sierra Leone, a few pediatricians, maybe less than 10 pediatricians in the whole country.
The initiative was encouraged by Pope Francis, who called for an effort to address gaps in children's healthcare around the world. The idea is pretty straightforward. Major children's hospitals with highly trained specialists, advanced equipment and research help smaller hospitals or clinics in other countries that may not have those specialists or resources. Patron President Fabrizio Pentivoglio and President for International Teladoc Health, Carlos Nueno, travelled to Rome and met with Pope Leo XIV to present and donate a telemedicine device to the Holy Father.
Of course, it was an amazing meeting with Pope Leo this morning, where we presented the work done by the patrons of the World Children's Hospital. Teladoc Health is a partner of the patrons. We provide technology that allows the World Children's Hospital to connect to underserved communities in countries in Africa or Latin America. And so the technology can allow us to connect all these amazing hospitals and bring care to places where, unfortunately, they don't have access to quality care.
Obviously, when you talk about children's life and healthcare in the developing part of the world, everybody gets excited, gets engaged, especially in these times, which are quite complicated. But the Pope was supportive. He shared his vision and his commitment.
The patrons of World Children's Hospitals have worked on many projects, and one of their most recent ones saved 2 very unique lives in Burkina Faso.
I was mentioned by one of our NGO's partners that there were 2 Siamese twins, 5-month-old girls, conjoined by the stomach in Africa, in Burkina Faso. And we had to rush to help and to try to operate them and separate them. Initially, I was very reluctant because of the complexity and the risk involved. But then obviously I got more involved and I got to know these girls through the material that was shared. And I couldn't say no, so we flew them to Genova, Italy, at Gaslini Hospital. We operated them. It was a 12-hour-long operation with 50 surgeons. I went to visit the girls in ICU. I met the mother, a 20-year-old girl, and I'm very excited to share that after 4 months, they've been dismissed. They're living their life, they're healthy, and they have a future.
With new telemedicine on the rise, the patrons hope that it's moments like this, with the Pope's encouragement, that can bring attention to the need for pediatric care in places where hospitals and specialists are hard to reach.
And so in 5-10 years, we hope to be able to save a ton of lives in many underserved communities in Africa and Latin America.
In Rome, Zofia Schubeck for EWTN Pro-Life Weekly.